Hello, I'm Dr. Alexander Sinclair. I'm a plastic surgeon. I practice in Beverly Hills, California. I do a lot of transgender work, and I've had the privilege to be able to visit FACIALTEAM. I'm awed by my visit here by the skill of the surgeons, Dr. Simon and Dr. Capitan. And it's interesting how I came to this place, because in the world of transgender surgery, there's a lot of competition, and not all surgical teams or surgeons are willing to collaborate and educate other doctors. Some of my patients had surgery at FACIALTEAM, and they were unanimously pleased with their experience, so that whet my appetite about the team here. And then at the Bangkok meeting, I had the privilege of hearing Dr. Simon talk about the FACIALTEAM experience. And I viewed my trip here as an opportunity to become more skillful and learn more about facial aesthetic surgery in the transgender population, and that absolutely happened. There are lots of choices for transgender patients, and I think it's very difficult for them sometimes to decide where to go and what to do, who's got the reputation, how should they spend their hard-earned money, because let's face it, this surgery is expensive. And what stood out to me about my observership here was really the camaraderie and the teamwork, the lack of ego that the surgeons had, the welcoming atmosphere. I talked with Dr. Capitan and Dr. Simon about this, and they really stressed that they have a team concept, and there's no one doctor that sort of rises above all the other doctors, and they're all here to provide superb care. One of the other things that really stood out to me was the amount of attention that's given to the preoperative assessment. So very often patients are left in the dark about what's going to happen, or they'll just have a global thing. I'm going to get facial feminization, something's going to be done to the forehead and the chin. And you know, as surgeons, when we talk to each other, we recognize that not all problems, unlike most patients think complications happen in the operating room. Well, I'm here to say that that's probably not true. Most mistakes occur because of inadequate preparation and assessment. And what the team here does is an outstanding assessment of what the individual problem is. They don't over-operate. They will make a diagnosis for each particular problem. By the way, that is what you're supposed to do in surgery before you do anything sharp. You want to have a diagnosis. So the surgeons have actually assessed the patient. They do it with much more than just a physical exam. All of the patients had facial CAT scans, three-dimensional facial CAT scans, which lots of doctors don't do. And so it's something that is important for me, is always to think about my surgery not when I walk into the operating room, but actually the night before, and or even a few days before. And I could see that's what the team here does, because on each patient walking into the operating room, all of the CAT scans were there, and there was a detailed surgical plan listed as to what would be done and why. And you know, this might seem normal to most patients, but it actually isn't. So this is really a very thorough process. One of the other outstanding observations here was the commitment of the FACIALTEAM to continuing medical education. We all have a debt of gratitude to those who went before us. Particularly in this surgery, there were trendsetters and people who went against the tide and sometimes fought social conventions and customs to be able to develop really quality care instead of some back alley hack job. Really, even until this day, there has not been a commitment by the surgeons, even the really good surgeons, to further the medical advancement of the doctors and surgeons that do transgender surgery. And both Drs. Capitan and Simon have published in prestigious peer-reviewed journals, and they do it in a way not as really to toot their own horns, but really to disseminate information to others. For me, there's no plainer way to say it than this. On a certain level, I am a competitor. I don't really like to say that or think that, but both of the doctors and the entire team here have welcomed me with open arms. I couldn't have been taken care of any better than I was. And they gave freely of all their skills and observation to me. That's incredibly rare in the medical world to do that. And so I have a great deal of gratitude for them. And then it becomes my obligation and responsibility to provide education for other people. And not only that, it becomes my obligation and responsibility is to tell the patients about the great work that's being done here. I have a son who is an intern in plastic surgery, so he'll spend another 6 years studying plastic surgery. So his education is supremely important to me because one day, who knows, I might like to have him take over my practice or practice with me. And I could think of no finer place for him to get a medical education or be exposed to surgical advances than at FACIALTEAM.